Rolling, and B is rolling.
I'm Maddie Robinson. I'm an entrepreneur. I'm a mother to a very rambunctious 4-year-old. I'm creative and confident, and I live with sickle cell disease. Under certain conditions, the hemoglobin in my red blood cells links together and can deform the blood cells to look like a sickle shape. This causes blockages and a whole host of other consequences that are really painful. I can go from having a normal day in the morning to by 3 p.m. being in debilitating pain, unable to walk, barely able to speak even. Being a mom is exhausting for anyone. So when you're working with just a little over half of the blood volume of someone of a comparable age and size, it's really caused me to think carefully about how I conduct my day and how I interact with my child. He can explain to people what sickle cell is. I taught him at a really young age, like how to dial 911, and I think it's just a whole new level of responsibility, because I know that there are times where I can't care for him.
I think the rare diseases are particularly special to me because they have not gotten the attention that they deserve.
Sickle cell disease in particular has been an area where drug development has lagged. This gave us really a sense of purpose and a sense of mission.
We've made great progress. We've actually come up with a molecule that attacks the fundamental molecular basis of sickle cell disease, and we hope to get the drug approved and available to patients as early as next year.
We learned that there's a lot more to the disease than just pain, and that understanding is one of the factors that enabled us to move this program so quickly through development.
We've had patients involved every step of the way, and I think that has tremendously improved our performance, and it's also been great for our relationship with the sickle cell community.
Being in the space and seeing, at some points working side by side with people who had just as much fervor and enthusiasm as I had, and I lived with the disease.
A big part of it for me is about really about doing meaningful work.
I think the U.S. has done an amazing job of really leading innovation in healthcare. And that's something that I think I'd like to see the U.S. keep that advantage. I'm very excited that over the next 4 or 5 years, we're going to have increasing numbers of great therapies.
If I could talk to young parents who have a newly diagnosed child, I would just really want to make sure that they feel hopeful. But I think now it's obvious that, things are coming to a new era.
If I could tell patients one thing, I would tell them that we're focused on solving your problems, and we're going to win.